what happens is as our bodies get more and more acidic, we have to buffer that acidity. Our bodies don't like to be acidic. So it has to buffer it. It has to neutralize it as fast as it possibly can. One of the best neutralizers in our body is called calcium. Where's calcium? Where's the largest source of calcium in our body? Bones. It's in our bones. So if our body needs to be alkaline, it's going to start pulling from the bony tissue. It's going to start pulling from that bone tissue to alkalize our body. The more and more acidic we get, the more and more calcium we have to pull from our bones. The more and more we lead to osteopenia and osteoporosis. Okay? So it's just one perpetual downward spiral as we start to get into this acidic environment. When your body becomes acidic, your arterial walls become damaged, okay, and they create inflammation. So this is how, again, your body will start to increase cholesterol. It's because as you start to create more and more acidity, well, your body's got to release more and more cholesterol in order to repair the damage because of the acidity that's creating the damage in your arteries. You have to do that in order to repair. Go ahead. Thank you. So what are the sources of acidity? Well, here you go. Meats, conventional meats, like your red meats, your chicken, your turkey, your deli meats, right? These all contain certain products, like nitrites, like your deli meats. That's gonna cause acidity in your diet. The grain-fed beef, right? So grain-fed, grains break down to what? Sugar. So the grain-fed beef, as you take in that grain-fed beef, you're breaking down, you're creating sugar into your diet, okay, into your body, releasing more and more inflammation within and around your body. Sugars, right? Refined carbohydrates. Sugar is acidic. Sugar is very, very acidic, and it destroys your immune system. The more and more sugar that you take in, especially in the winter months when your vitamin D drops, your chance of getting sick from the flu or any type of other virus or bacteria just skyrockets. Caffeine, salt, alcohol, tobacco, artificial sweeteners, and obviously all medications form acidic problems in our body. Cancer, keep drinking pop, right? And the reason for that is because the University of Minnesota did a research study about a year ago. And it showed that if you consume 2 pops in a week, not in a day, in a week, it increases your chances of pancreatic cancer by 86%. 86%, your chances of pancreatic cancer go up with 2 cans of pop in a week. Okay, and it was done right here at the University of Minnesota. So, obviously, it's right here. 2.5 is where the Coke is. So it's 50,000 times more acidic than neutral. So it's 50,000 times more acidic than neutral. It takes 30 cups of water to neutralize one can of Coke. So you drink a can of Coke, you must drink 30 cans of water in order to neutralize your body. Okay? Otherwise, it's in an acidic environment, you're creating disease. Okay? So you have to make sure that we're avoiding these things that are creating acidity. Go ahead. The top 10 toxic foods, here they are. Okay? These are things that we want to avoid. These are things that create acidity, they create toxicity, they create a nasty environment inside of our bodies. Salad dressings. Okay? Salad dressings are absolutely horrible unless you make your own at home. Candy obviously contains lots of sugar. The deli meat we talked about with the nitrites, the white bread, there's probably more nutrition in the plastic bag that it comes in versus the white bread. Okay, the whiter the bread. What was that? I gotta think of something.
The whiter the bread, the sooner you're dead.
Thank you. Who said that? Where did we hear that from?
At Home School Kids.
At Home School Kids. Yes. The family in the back. It's a great saying to live by. The whiter the bread, the sooner you're dead. Right? And there's truth to that. So obviously sprayed produce, we're taking in more and more chemicals in our body. The margarines, the diet sodas that we talked about, the genetically modified foods, commercial dairy, and then your seasoned packaged foods. These are the things that we want to avoid in our diets and from putting into our bodies. So what is the alkaline diet? Right? What is an alkaline diet? Well, here it is. In our Maximized Nutrition Plan book up front, these are the things that we give to, like when a cancer patient walks through my door, they go on this advanced plan right here. They can't have sugar. Cancers have an affinity, high affinity for sugar. It has about 18 receptor sites. Each cancer cell has about 18 receptor sites for sugar. If you take in sugar, it's like adding fertilizer to your grass. You're adding fertilizer to that cancer, and it's just going to grow, and it's going to grow rapidly and very, very quickly throughout your body. So if you want to avoid it, well, this is the way that you do it. If you want to kill it, well, this is the way to do it. You starve it of the food that it wants to consume. You starve it of its sugar. You starve it of its food. That's how you kill any animal. So the Maximized Living Advanced Plan is designed to be an alkaline diet. With the majority of healthy nutrients coming from the raw, some from cooked vegetables, and healthy meat sources, and then your healthy fats.